Hello, I'm Barbara Brandt, Director of the National Center for Interprofessional Practice and Education. Today I'm introducing our webinar on Fundamentals of Interprofessional Education and Collaborative Practice Measurement 1, knowing what you really want to measure and selecting the right tool. And as I begin this webinar, I would like to say this is the #1 request of the National Center, and we've been responding to the needs as they're expressed to the National Center. The National Center is a jointly accredited provider, and we are offering credits today for a slight fee for those of you who want it, to physicians, physician's assistants, nurses, nurse practitioners, and pharmacists. And as required, we have a, I think we're having a slide issue. We'll get it fixed in a second. I'm going to be pulling up the disclosure side that we have no disclosures to report for this particular webinar. So we want to make sure we're advancing the slide. And just so you know, our machine is frozen up, and we're doing a little shuffling in the room. So a little bit about the National Center's Interprofessional Education and Collaborative Practice Assessment and Education. So our mission in this focus on the National Center is to promote best practices in assessment and evaluation within the National Center as far as interprofessional education and collaborative practice communities. So what is the need? So I told you that this is the #1 request of the National Center. These are the types of questions that we receive about assessment and evaluation for interprofessional education and collaborative practice. And we have just changed to another computer. So I'm starting with this slide again. And to tell you that, again, measurement, assessment, and evaluation for interprofessional education and collaborative practice is the #1 request of the National Center. And these are the types of questions we receive. How can I assess interprofessional education and collaborative practice in individuals and teams? How can I evaluate interprofessional practice and education programs? What instruments are available? What makes one tool better than another? And how can I select the right tool? So this is the National Center's response. We are committed to building capacity in the logic of instrument appraisal and selection. So one of our responses is that we wrote a primer 2 years ago on measurement and tool selection, which was authored by Connie Schmitz, who will be on this webinar, and Michael Cullen. So this is freely available on nexusipe.org. So these are our presenters today. Connie Schmitz, who I've worked with for the last at least 3 years, both at the University of Minnesota in our One Health IPE curriculum, and now in the National Center. Connie is an educational psychologist. She's curriculum development, learner assessment, program evaluation, and educational research. She has served as a consultant to the National Center in measurement collection. And then her experience, the breadth of it is amazing. It's in the academy, foundations, and government agencies. And she's a scholar and has written over 30 publications and 45 technical reports. So Jane Miller has been an interprofessional leader at the University of Minnesota. She was the founding director of the Academic Health Center here at the University Simulation Center and our Interprofessional Education and Resource Center. She has served as an assistant professor in our Family Medicine and Community Health program and is on the graduate faculty in our College of Education and Human Development. As far as national service, she is in the Society of Simulation and Healthcare and the National Center. Jane is also a scholar in collaborative practice, performance-based assessment as she runs our simulation center, and acquisition of interprofessional team skills. A little bit about the framework that we are, how we have built capacity. So if you go on our resource center, at the beginning, we've had a community where we had people openly open source and put their own tools, and that is still going on in the resource center. We learned a lot about that, and people were looking for more rigor as far as our assessment of our measurement collection. So we now have an assessment and evaluation homepage, which houses a measurement collection that has been vetted by an advisory board. It is quantitative tools to measure interprofessional education and collaborative practice processes and impacts on the triple aim. And it supports generalizable evaluation and research. And then our support resources are the primer that I've mentioned. There's an editorial about the ripples, has been a very common instrument that has been used in the field. There's a consumer's report on team assessment tool, and we have available for a small fee practical guides on assessment and evaluation. So with that, I'm going to turn over the rest of the webinar to Connie and Jane.
Thanks, Barbara. This is Connie, and hello and welcome again to everyone. Sorry for our technical problems, and hopefully we're all on the same page now. So this webinar series serves as a companion to the measurement primer. And the primer describes three main criteria to consider when selecting a tool. Criteria number one is to determine whether the tool is relevant for your needs. This criterion forces you to think deeply about who and what you're trying to measure and why. Criterion two is to review the tool's psychometric strengths and limitations. And this step requires some understanding about the nature of validity, the concept of measurement error, and what the validity statistics reported in the literature actually mean. Criterion three is to assess the feasibility of implementing the tool in your setting. And this step focuses on operational and resource issues related to data collection, analysis, and reporting. In today's webinar, we will focus on criterion number one, relevance, and in our webinar next Thursday, we'll be looking at validity. Before we talk about relevance, however, we need to clarify some differences between certain terms and discuss the necessity of planning before selecting instruments. Then we'll talk about types of measurement tools and walk through criterion one of the tool selection process, ending with a brief example. Terms such as measurement, assessment, evaluation, and research are used in different ways and sometimes interchangeably by different people. Here's how we use them. Sorry. No. Sorry, the slide advancing. No, we want to go forward now. It was a little delayed, so I'm not catching up with it. So measurement refers to the science of how we measure something. And this science covers such things as measurement error, reliability, and validity, which are germane to any measurement process and tool. Measurement will be the focus of part two of this webinar series, which is explained. Assessment means the measurement of knowledge, skills, attitudes, behaviors, or perceptions of individuals, groups, teams, or environments. Assessment data can be quantitative or qualitative, and can be used for different purposes, from grading students in a class to identifying appropriate clinical sites for IPECP training to benchmarking team performance for quality improvement. Evaluation means evaluating programs designed to teach or affect desired knowledge, skills, etc. to achieve larger aims. In assessment, we make observations or judgments about individuals, groups, or organizations. In contrast, in evaluation, we make observations or judgments about programs, how they were designed or implemented, and how effective they are. And by the way, I'm using the word program very inclusively to mean really any kind of intervention, from a one-day workshop to 6-week internships, mentorships, programs, etc. Importantly, evaluation plans are designed to serve local stakeholder needs, such as program evaluation, improvement, expansion, or termination. Finally, research shares many attributes of evaluation, but the goal of research is broader. It is to establish new knowledge, and that includes developing new theories, gaining new understanding of current conditions, problems, or practices, as well as testing new ways of doing things. Research serves the needs of the field. It seeks answers to questions that go beyond local data needs and decisions. So to summarize, assessment data are almost always used in evaluation and research. But evaluation and research have purposes that go beyond assessment, and their agendas are different. So let's talk now about tool selection. Tool selection starts with a larger plan for how you're going to assess individuals, groups, or entities, how you're going to evaluate a program, or how you intend to research a question of interest. You should not pick a tool before you have a plan in place. To do so would be like putting the cart before the horse. Planning for assessment includes these 5 components. As shown here, in order to select an appropriate tool, one needs to have thought about the purpose and context of assessment, the precise things you're trying to measure, and the general approach or strategy. And we really encourage you to look at practical guide number 3. As Barbara mentioned, that's on the Nexus website, because that guide focuses entirely on assessment planning. Before you search for an instrument, you first need to clarify your overall goals and purposes. What are you really trying to figure out or know? Are you trying to identify or diagnose training needs in order to build curriculum or design remediation strategies? Will you be using assessment data in a low-stakes situation to teach teamwork behaviors, or in high-stakes settings to judge team performance? Will you be assessing a captive audience, such as pre-licensure students taking a required class, or practitioners attending voluntary training for continuing education credits? Or are you assessing actual practice as it occurs in a face-to-face context, such as weekly patient rounds in a hospital ICU or via remote video conferencing? You need to be especially clear about what you're trying to measure. What scope of knowledge, what types of skills or behaviors, what constructs or elements of collaboration, teamwork, etc. are important to you. The second important distinction among tools, there are also many different kinds of measurement tools. Backing up. Given the context and desired measures, you need to think about the opportunities and constraints for collecting assessment data. There are many different methods, such as online surveys to in-person interviews to debriefing protocols to 360-degree feedback. You need to think through the design of your assessment, when and how often the data will be collected. Design decisions should reflect what you intend to do with the data, which goes back to your assessment purpose and goal. There are many different kinds of measurement tools, and as you begin to review them, keep in mind several important distinctions. The first concerns the source of data. Is this instrument designed to collect self-reported information, or information from an outside source such as observations, ratings from others, tests, or data extracted from organizational or healthcare records? This slide shows examples of the kinds of information that might be gained from each of these sources. Currently, measurement in the IPECP field is predominantly self-report. Information from the other sources is really needed to understand the effects of training on practice and the effects of collaboration and teamwork on outcomes. The second important distinction among tools concerns who or what is the object of assessment. Is the instrument designed to collect data on individual people or on groups as a whole? For example, do you want to know about an individual's contribution to team performance, or do you want to know how the team as a whole performs? Instruments designed to collect individuals' knowledge, skills, attitudes, or behaviors provide scores for every participant. Individual data can be aggregated up to produce a group-level statistic, such as a mean. But instruments that assess the collective attributes of a group, team, care model, or other organizational entity result in a single score, or a set of scores for different variables for that entity. They cannot be disaggregated to the level of the individual. So knowing the difference between these types of tools is essential for getting the information you want. So let us focus now on criterion 1 of our measurement primer, which concerns the relevance of a given instrument for your needs. The three main things that help determine the relevance of a tool are its content, its purpose, and the audience for which it was intended. In assessing content, the objective is simple. Do the questions, tasks, constructs in the tool cover what you're trying to measure? So, for example, if you're a teacher, you probably want to know if the content encompasses topics that you're teaching. So you look for alignment between the learning objectives and the items of task on the tool. If you are a program evaluator, for example, you probably want to ascertain the relevance of the tool's content to the program's overall goals. If you are an administrator responsible for IPE, you would want to assess the degree to which the types of knowledge, skills, attitudes, or behaviors measured by the instrument match with standards or competencies agreed to by consensus groups or accrediting associations. If you're a researcher, you want to know if the constructs being measured address your research questions. Purpose. The objective here is to see how the tool's intended purpose aligns with yours. Will the tool give you the type of data you need to fulfill your assessment, evaluation, or research plan? This is where questions of individual versus group level scoring and high stakes versus low stakes purposes come into play. Now that said, many tools are actually pretty flexible and could be used to serve multiple purposes. For example, a tool originally designed for high-stakes testing could be used for developmental teaching and learning purposes. What makes a tool suitable for high versus low-stakes purposes depends, in part, on decisions you make about how you want to use the data. To make an instrument originally designed for high-stakes assessment suitable for low stakes, for example, you could have participants score themselves rather than be scored by trained external raters. Or you could have raters complete the rating tool, but not assign a total grade or score to the individual, but just use the scorings to discuss them with the student or learner as part of feedback. Intended audience. The question here is whether the tool was designed to collect information from people and places that are similar to yours. Now, similarity is important for two reasons. One concerns the applicability of items or tasks in terms of difficulty, relevance, wording, or tone. You don't want to give a tool that measures advanced knowledge to skills or skills to novices or vice versa. Similarly, instruments written in English may not be shelf-ready for non-native English speakers. Some tools are somewhat generic and flexible, and others are not. For example, some may be designed for a very specific healthcare context, such as end-of-life or ICU management, or for specific interactions, such as physician-nurse collaboration. It's helpful to see whether the tool has been used successfully in different settings. The second reason why similarity is important is because the validity statistics reported about a tool will reflect the nature of the respondent groups and the circumstances under which the data were collected. And we'll talk more about this point in our next webinar. Putting it all together, okay, in this presentation we've introduced the first of three important criteria for instrument selection: relevance, validity, feasibility, and we've also elaborated on the components involved with relevance, namely content, purpose, and intended audience. But we've also talked about the importance of planning as a precursor to instrument selection and alerted you to some important distinctions among tools, such as self-report versus objective data sources and individual versus group-level data. So now it's time to show a brief example. And for this, I turn the microphone over to Jane.
Thanks, Connie. Here at the University of Minnesota, we have a required 6-week introductory IPE course for pre-licensure students enrolled in the 6 health profession schools that comprise the academic health center. The course is called FIPSI, which stands for Fundamentals in Interprofessional Communication and Collaboration course. In 2014, we reviewed some literature and selected a tool called the Interprofessional Collaborative Competency Attainment Survey, or ICAS, as one of several tools for evaluating FIPSI. So this is a good instance of using student assessment data for program evaluation purposes. And it's important to remember that student scores were aggregated to the level of the school and were not used as part of an individual student's course grade. The ICAS is a 20-item self-assessment tool. It was developed at the University of Ottawa, Canada, as part of a nationally funded initiative in IPE program evaluation. Its items were written to reflect the 6 constructs listed here. Each of these items represents a distillation of a behaviorally worded competency, and its authors derived it from a literature review, which was they were intentionally grouped to reflect constructs that are embedded in the Canadian Interprofessional Health Collaborative Competencies framework. The ICAS was developed to help local faculty evaluate their IPE courses and programs. The authors recommended the tool to be administered using a retrospective pre-post assessment design. That is, at the end of the course, or in any case, a seminar, a workshop, or other type of intervention, participants rated their skill level on the 20 items. They actually rated themselves twice. First, as they perceived their skill levels to have been prior to the intervention, and second, as they perceive them now after the intervention. Analyzing the pre-post changes enables faculty to estimate the impact of the course based on information provided by its participants. The ICAS was administered to a large sample of diverse health professionals who were enrolled in a variety of IPE programs across Canada and New Zealand. While most of the participants were students working toward their first professional license, some were experienced practitioners from the community, but all were participating in their respective IPE interventions for the first time. In reviewing the ICAS, we found a strong alignment with the I skipped a slide. There were several reasons we selected to pilot and then eventually use the ICAS. Some had to do with the positive evidence of validity reported in a journal article, and some were due to its feasibility, given our setting and resources. But clearly, the instrument seemed relevant to our needs in terms of content, purpose, and intended audience. So in reviewing the ICAS, we found a strong alignment with the instrument's 6 constructs and the FITSE learning objectives and course topics listed in the syllabus. The syllabus had been fashioned to cover the 4 domains that comprise the IPECP core competencies outlined by the Interprofessional Education Consortium, which is a national effort among 6 professional accrediting bodies in the U.S. In terms of our assessment purpose, we needed to supplement the current satisfaction surveys we used for course evaluation with a more concrete self-assessment of students' behavioral skills. The ability to estimate pre-post gains using retrospective design gave us greater confidence that the results would be meaningful. The scores would enable us to examine differences among our subgroups, such as medical students and others. We found no need to change any wording in the items, which were clear and generic in tone and language. The size and professional diversity of the ICAS research sample increased our confidence that the items would work for our students. The ICAS worked well in our setting. It was easy to administer, score, and interpret. The results suggested that the tool was sensitive to what we were teaching and could differentiate among student groups who were well satisfied with the course and those who were not. We found the data to be reliable. We also learned that a single explanatory factor, rather than separate factors representing 6 different constructs, explained a large proportion of variance in the data. And to learn more about what these validity findings mean, check out the article and register for our next webinar. All right, so now we want to hear from you. This concludes the formal part of today's session. And what we'd like to do in the next couple of minutes is hear from you and hear what kinds of questions you might have. So one of the things we wanted to do is, in addition to having you write in your questions, is have you consider these 3 items. What was the muddiest point for you? Did anything that we say surprise you? And what might you do differently as a result of this presentation? As I said before, you can also continue to type in your questions, and we will respond to those. In the meantime, while you're thinking of your questions and typing them in, we wanted to talk a little bit about one example. One of the questions that we often get is, can you modify an existing tool? And the answer is yes. And so I'd like to tell you about an example where we did just that. In 2016, my group in the IERC and the HC Simulation Center were awarded a small grant to develop a simulation-based curriculum and assessment of our team skills of nurse midwifery students and OB-GYN residents here at the University of Minnesota. There are many good teamwork assessment tools, specifically in obstetrics and gynecology, but for our project, which covered a range of clinical environments and interprofessional collaborative practice challenges, we felt we needed a more general tool that would adapt well to our study goals. And I ended up choosing the modified McMaster Ottawa, based on the criteria listed here that are very consistent with the kinds of things we've already talked about in this webinar. The constructs matched well. It was both an individual and team assessment tool in one, and it had the right level of feasibility for our group. It was fairly easy to achieve an acceptable level of scoring consensus with the MMO using the behavioral anchors. One question is, why reject the other tools and select this one? As you may have experienced yourselves as people who are interested in assessment of interprofessional education, many times the tools, validated tools, are too context specific. Again, as I mentioned, we were designing simulations and assessments that were applicable to a variety of different clinical environments. And many of the excellent tools that are out there are either very oriented to a specific clinical context, specific set of technical skills, or end up being a little too onerous for expert evaluators to be able to complete reliably in the time provided. As always, it's important to consider what were the threats to validity. And although the modified McMaster Ottawa did meet the most important of our selection criteria, it still required some minor modifications for our uses. In that case, it's important to acknowledge that those changes can be seen as threats. So, for instance, formatting and minor wording changes used by particular evaluators, who in this case did not necessarily represent the same professions as those in the validation study. And in our case, the addition of a global item to assess the gestalt of the performance were all changes that need to be considered in how the results are represented. Now, I see that a number of you have provided some questions and comments, and I'm going to turn things back over to Connie.
Great. Thanks, Jane. And just to follow up on what Jane has presented, that question about can we modify tools, as she said, comes up all the time. And actually in my practice as a program evaluator, I've often amended tools. There are a lot of things you want to think about when you do that. We'll talk about some of them in our second webinar next week. But there's some information on the website. Again, under the assessment and evaluation homepage, we have some frequently asked questions about using and amending tools. Just briefly to recap some of them that I can think of off the top of my head. I always think it's good professional courtesy to contact the author and let them know that you're interested in using the tool. If the tool's been around and they've been contacted a lot, they may just say, great, thanks, or they may not even respond to you, but at least you've done your part to let someone whose intellectual property is going to be used, that's going to be used. If you're going to amend the tool beyond minor word changing, you really do need to talk with the author. Even if it's open source, I recommend that you do that. And then once you've made the changes, you have to consider some things like, can you still score the tool originally as it was designed, or if you've made so many changes, added items, deleted others, that in fact you need to reassess the tool's reliability and validity. Again, we'll talk more about this next week, but piloting any tool that you're adopting or adapting is always a good idea. So one of the other questions that I see here is, someone writes in, I would like to know your thoughts on utilizing a quasi-experimental or pre-post experimental design for IP team assessment. I think it's great. I think that's excellent. It all depends, of course, on how well you can comprise your comparison groups and control for some of the threats that can happen with that to external validity. But as an approach, I think it's very good. And in general, we need to be using some of these more rigorous approaches, in my opinion, if we're going to really advance the field and look at the impact of teamwork, for example, on important outcomes. So someone else has written, it would be helpful to have some data from the ICAS to show an example of information gained and how it was applied. The best thing you can do is go to the article by Doug Archibald. And if you also go to the Nexus website, the assessment and evaluation page, the ICAS is one of the tools that is in our measurement collection. The citations are listed there. And I think my paper that I wrote is also on the website, but I'm blanking on that as well. And that will show more of the data. Yeah, it's in JIC. What other questions? What was the muddiest point for you in all of this? We developed this first webinar for people that we imagined were pretty new to assessment, and we're probably starting at the point of thinking, well, what tools they want rather than what am I needing to measure. And so I hope that was one of the main points that came through here. Any other questions that have come in? I'm having my friendly Stephanie bring up some more of the questions that are coming in. Can you use ICAS for student assessment? Absolutely. It is self-report, so I wouldn't assign a grade based on their assessment, but you can certainly use it for looking at sort of group results, talking about the group, about what they have learned, more informal feedback rather than assigning a score.
Can I talk about that a little bit?
Sure.
Address that as well, Connie. So this is Jane, and Connie makes reference to her excellent paper about how ICAS is used for FITSE, but I would say that in our simulation center and in our interprofessional performance-based assessment projects, we have also used ICAS on the course level. And again, I want to underscore, students are not assigned a grade based on their ICAS results, but we are using that on a course-by-course basis to understand better what the outcomes are for the groups as a whole in terms of their perceptions of their IPE skills growth. So if that's helpful at all to you, it's certainly been very useful to us in also sharing that information, for instance, with preceptors as those learners are about to go out into clinical rotations with interprofessional teams.
Good. Another question, are there any special considerations in picking a tool if you're hoping to publish results from your IPE evaluation? I think what I would be thinking about if I want to publish is to use tools that have some strong validity research behind them. So looking at one that has a good provenance in the literature, so to speak, one that has been used in enough settings so some of the validity statistics are stabilized. Again, we'll go into some of that next week. Another question, is there literature on how to reduce ceiling effects? For example, students often report very positive perceptions of teamwork because it seems like a right answer. Well, we've all seen that, haven't we? and for those of you who don't know, that term ceiling effect means that the ceiling is too low, meaning that the range of options on a rating scale are so low that everyone is picking the top answer. If it's in a test, it means that everybody gets the right answer to the test. The way to fix that is if you're in the process of developing an instrument or finding an instrument, is one that has a broader range of response options. So the scale is literally bigger. But the harder question is, how do you set the right tone for the assessment when it is self-report? So the students truly feel that they can be candid, and you can do some other things in piloting an instrument to make sure that they can respond to the items and the tasks in an authentic manner. Some of the tips, tools, and the tricks of the trade are, if you're the teacher of the course, have someone other than yourself administer the survey, make the survey anonymous, detach the survey from any consequences such as a grade. But it's mostly the tone that you set, I think. Maybe Jane has other comments here about why you want the information and what you're going to do with it. And if the students feel that their honest responses are going to make a difference, then they're more likely to give it.
Yeah, thank you, Connie. There's another name for this called social desirability bias. where, again, the social desirability of answering a particular way is what conditions the actual response. So anything that is a self-reported or a perceptual sort of assessment has that as a, you need to consider things like social desirability bias in using that tool. Another recommendation is to have more than one assessment or more than one type of assessment that you're also using to try and come up with results about whether or not or to test your hypothesis about whether or not the skills have actually changed or at the level that the individual learner or group of learners actually perceives they're at. So I made reference previously to our use of the modified McMaster Ottawa, and in that particular project, one of the reasons that I know it was funded, and one of the reasons we wanted to pursue it was because we were using multiple perspectives on performance: self-report, expert observer, and patient perception of what the teamwork was actually like. So having more than one type of assessment also tells you a lot about how people are perceiving their own performance in a team, and how others are perceiving it based on their perspective.
Good. That was a great question and a great answer.
Yeah, super.
Another couple of quick questions. Can we use the SPICE 2 instrument for course evaluation? So I'm glad to hear someone has brought that instrument up. It's in our measurement collection, and it's a very good tool. And yes, this tool collects individual level data. And as I think we covered earlier today, you can take all of the responses from those individuals, aggregate them to a group, create a mean, and then see whether the mean has changed from pre to post or post to delayed post if you're doing course evaluation. This is under the assumptions that, again, you feel that self-reported competency on self-assessment of those competencies is relevant to your assessment plan. Another quick question: is it possible to get a copy of the PowerPoint presentation? And the answer is yes. And how do you do that?
We'll send it with the archived webinar, and we'll post it on the Resource Center after this webinar.
Are there other questions, or are these? Let's see. Another question: how does the ICAST perform compared to other instruments based on our experience? Wish that I had experience that I could share with you on that, but I haven't used the CPAT or the other instrument. The two instruments that are acronyms are CPAT. The other one is ATHCTS. And the latter one, I believe, is Attitudes Towards Healthcare Teams. CPAT, I can't quite remember what that stands for. I'm sorry. So my experience is limited me. I haven't compared those in any direct sense. I'm not hearing what was the muddiest point, but that doesn't mean your questions aren't good. We still have 15 minutes or so left. I'm happy to answer any other questions. Of the many, okay, go back up to, of the many excellent tools available, are there any gold standards that you're aware of, and how do we know about them? Well, we get that question a lot too, and over the years, Barbara and I have talked about it because we feel the National Center really isn't able and doesn't wish to be the arbiter of tools. We don't rank them, we don't rate them. We did closely vet the tools that we put into the measurement collection. So I think all of those, we would say, are good tools when used for the purposes for which they're designed. But it really depends so much on how the tool is used and how it fits with your context and whether it meets your purposes that we're really unable to say what's the right tool for you. there are all new tools coming out all the time. A lot of them need more reliability and research, validity research on them for any person to say. But tune into our next webinar. You'll get some more clues then. What tools do you recommend to determine a course curriculum evaluation? I think the answer that I just gave is kind of relevant again here. I think our best advice is to walk through the 3 criterion that we're talking about: relevance, validity, and feasibility. We're trying to teach you how to fish rather than give you the fish. We're trying to teach you about the underlying logic of how you appraise an instrument, what you look for, how you think about it. It's just really difficult from the 10,000-foot level to say this is the right tool for a course curriculum evaluation. I know that's a hard answer, not one you want to hear. But long term, it's better that you learn how to walk through some of these steps.
Yeah, I've noticed that, this is Jane again, I've noticed that we've been getting a number of questions about the potential implications of modifying a tool and publishing research based on using tools that are altered in some fashion. And I would say it really does come back to those 3 fundamental criteria that Connie started with. I know that when I'm reading a paper for publication as a reviewer, one of the things I'm always looking for is the fit, is how well did the tool actually match the hypothesis being tested, the questions being asked, and it's not so much selecting the tool with the best validity study, but rather the tool that has had some sort of acceptable validation, but is more than anything applicable to the context in which it's being used. So I think sometimes we tend to overemphasize what, in thinking about a gold standard, we tend to overemphasize the number of validation studies versus the applicability to the context in which it's actually being used.
Yeah, it's not how many times a tool has been cited.
Right, exactly. And we have lots of examples of tools that have been cited a great many times, but aren't necessarily as useful to a particular context.
I think also at this point it might be good for us to reiterate things we've said in other places and times, which is, if at all possible, when you work through an assessment for evaluation plan or research plan, you should be talking with someone like an evaluation specialist or a statistician once you get to the actual tool selection and design of what you're doing. They can be invaluable colleagues. I know that some of you may not have access to measurement professionals. At the back of the primer, we give some suggestions on where to find them. Hopefully you've all been successful in downloading the primer from our website. Well, unless there are any other questions, Barbara, do you have any final comments you want to say before we wrap up?
So I want to thank both Connie and Jane today, and those of you who joined us. Your questions were excellent. We are, just so you know, the people who are in our network, we are looking at instruments that we will be using in the network, just so we can start collecting data very specific to that project. And we'll be talking more and more about that, particularly starting at the summit. So I'm going to close out this session, and thank you all for joining us. And we will be here to next week. So if you can provide us feedback, we'll be sending out an evaluation, providing us a feedback so that we can give your input for next week.
Actually, small clarification about that, Barbara. there's a pre-survey that went out that
Okay.
we hope all of you do complete because it will give us more information about who you are, and that will help us tailor next week's webinar even further.
Right.
We're not giving out an evaluation survey for the two webinars combined until after next Thursday's webinar.
Okay. Sounds
But
fair.
that's definitely where we want to hear more from you.
So again, thank you very much for joining us, and we'll talk to you next